Hello, my name is Dr. Samuel Tam. I completed my orthodontics residency from the University of British Columbia Faculty of Dentistry Graduate Orthodontics Program, and I'm currently practicing in Vancouver, British Columbia, Canada, as a diplomate of the American Board of Orthodontics. Today, I would like to share with you an interesting case treated under the supervision of Dr. Vora for the How Would You Treat This Malocclusion section of the PCSO 2020 Bulletin. The patient is an 18-year, 3-month-old African-Canadian female who presented with a non-contributory medical history with fair oral hygiene and a chief concern of wanting her teeth straightened and the gap closed between her upper front teeth. On initial facial photos, she presented with a convex profile, acute nasolabial angle, and protrusive lips with a slightly everted lower lip ahead of the aesthetic plane. Additionally, she has shallow labial-mental fold, slight mentalis strain with a slightly increased chin-to-throat length. The patient also appeared to have a slight skeletal asymmetry, bimaxillary protrusive profile, and on frontal photo, upon smile, she displayed 90% incisal display. On her intraoral photos, the patient displayed an asymmetric class 3 subdivision right dental malocclusion with procline upper and lower incisors. More specifically, she presented with a class 3 molar relationship, that being a half cusp on the left and full cusp on the right, with a canine class 3 relationship bilaterally. The patient's models show minimal overjet and edge-to-edge incisor relationship with proclined and protrusive upper and lower incisors. She has 0 millimeters of overbite with a minimal curve speed. She displays a good buccal overjet in the posterior segments, and her maxillary midline is coincident with her face, while her mandibular midline is 3.5 millimeters to the left of the facial midline. There is also mild spacing in the maxillary arch with a 1.5 millimeter diastema and mild crowding in the mandibular arch. On her panoramic radiograph, the patient has all permanent teeth present, including all 4 developing aids. There is no sign of jawbone pathology, with root dilacerations noted on teeth 1, 7, 1, 6, 2, 1, 2, 6, 3, 7, and 3, 6. The patient's cephalometric evaluation reveals a slight class 3 tendency with a Witts appraisal of -2 millimeters, an A and B of 2 degrees, and an increased mandibular plane angle. The appearance of double borders of the mandible on the cephalogram supports the previous noted observation of a potential skeletal asymmetry with her chin deviating to the left of her face when viewed on her frontal photo. The patient's cervical vertebral maturation stage was determined to be CS6, which means the patient's peak in mandibular growth has ended at least 2 years before the stage. The following treatment options were offered. The first option was comprehensive orthodontic treatment with full fixed orthodontic appliances, extraction of the maxillary second premolars, mandibular left second premolar, and right first premolar. The second option was comprehensive orthodontic treatment with full fixed orthodontic appliances, extraction of the maxillary second premolars and mandibular first premolars. The third option was a non-extraction treatment option with full fixed orthodontic appliances with class 3 elastics. This plan was presented with the caveat that her chief concern would not be completely addressed. If you are interested in how this case was treated, please go to the PCSO Bulletin 2020 Fall Edition for more information. Thank you for your kind attention.